Thank you. Hi, everyone. So, let's do a quick temperature check around the room. Not the heat wave temperature check, emotional interior landscape temperature check. How is everybody doing on a scale of 1 to 10? 10 being great, 1 being not great. Sometimes it's easier to give a number than a word. Shri Priya, I need to take that up with you. Great, 9. Okay, for those of you joining us just now, I've just asked you where you are on a scale of 1 to 10, not the pain scale where pain is high, but just 1 to 10 where 10 is good. And just to get a sense of where everybody is. Because today's session actually can be a bit of a heavy one. We're talking about grief and bereavement. And so if anybody is feeling slightly shaky or not so good, then it's probably a good idea to also reach out to me on the side on in the chat box. We will be touching upon, I mean, mostly we're looking at the theoretical framework today, but I mean, we can't really remove ourselves from our personal experience. 3, because there's no electricity. Okay, fine. Not because there's some emotional issue. All right. But thanks for joining us in spite of that. So yeah, so we can't really remove ourselves from these theories because I think especially in the last few years with the pandemic and everything, the experience of grief has come home to a lot of people. And so grief can be something that I don't think any of us are untouched by it. So we're going to be talking about this from time to time. We will pause, we will reflect like we do in all our sessions. Please feel free to use the chat box either to reach out to me directly or just to the group in general with any kind of reflections or comments or questions that you have. As especially in this session, if something is coming up for you that is very personal, I will request that you try and hold that sharing till towards the end of the session, because we will need to address it if it comes up, and that kind of derails the sort of time management. I'm not a great time management person, so that derails us a little bit more. So anyway, without without waiting any longer, if you can turn on your cameras, that'll be great. Okay, so grief. Let's start with, is there anyone in this room who is unfamiliar with the idea of grief, either in experience or in terms of what it means? Put a hand up if you don't know or have not experienced grief. I don't think there's a single human being here that hasn't. Okay, so we are going to specifically talk about grief in the context of caring for people with palliative care needs or being caregivers in palliative care situations or in situations of advanced and chronic illnesses. So that's the approach we'll be taking. And I will try and put it within certain frameworks that, like I've said before, the psychologists here might be familiar with some of these frameworks, but this is how we apply these frameworks to the context that we work in. I also want to clarify that I'm not certified as a grief counselor, but this is just, material and content that has curated over 23 years of working in this field. So you might find that when you go for grief counseling certification, you will find a lot of this stuff there, but you might find different approaches as well. Okay, all right. So let's hope that the tech gods are smiling at us today. Yes. Okay. So what is grief? Grief and the rituals of mourning are healthy adaptations to loss. And I have highlighted the words healthy adaptation. Okay. So it is, if we're human, we experience grief, and that is a healthy response. So grief is a response to loss. Mourning is the expression of grief. And all of these are dependent on culture, social context, and family dynamics. Okay, so grief is response to a loss. Mourning is how we express that grief, and everything is culture specific. And I want to be clear also that we are not only talking about death as a loss. Okay, in the course of somebody's illness, there are several kinds of losses, and by now you've been in a few sessions with me and with other facilitators. So, what are some of the losses that people experience in the course of being diagnosed, treated, and living with serious conditions? What are some of the losses that people might experience? Chat box is open, and you can also unmute yourselves. Loss of mobility. Thank you, Aparna. Yes, loss of mobility, loss of function. Okay, what else? Cognitive loss. Yeah. Intimacy, very big one. Yeah. What else? Loss of senses. Yeah. Loss of jobs. Relationships, career, financial independence. Yep. Keep them coming. So we experience various kinds of losses along the way, and every single one of those losses warrants grief or a grieving process, because we lose something. When we lose something that we care about, grief is the most natural and healthy response to have. So some of you talked about relationships, and some of you talked about mobility and stuff. Let me just go one by one. Identity and customary roles. When I uh, when I am when I am diagnosed with a serious illness, what uh, what what happens a lot of the times is that I go from being a teacher, doctor, counselor, sister, mother, aunt, to being a patient. Suddenly, my identity is defined by my disease. And my customary role, what is my customary role? It might be a professional role that I have. Someone said loss of a job, but it's also the customary role I have within the family. I might be the one who resolves conflicts. I might be the one who uh, is the keeper of secrets in the family. Okay. I might be the one who does all the grocery shopping. I might be the one who handles all the maintenance issues. Now, those are role expectations that have been expected of me that I fulfill. And when I have a disease or a debilitating condition, I am not able to perform that. And therefore, I lose that customary role as well. So the role can be an emotional role. It could be of a nurturer, a provider. It could be of a caregiver, a secret keeper. It could be all of that. It could be a practical role. Okay. And it also could be to do with your private life as well as your professional life. Physical function, some of you talked about mobility, and the loss of physical function is a big one. It's a big one. When you are no longer able to perform a physical function on your, I can't have a bath without assistance. I can't eat without assistance. I need help to use a bedpan. All of those things are huge, huge, huge losses. For some people, it's a very gentle loss. It happens over a period of time. But for others, from one day to the next, one surgery to the next, one tumor to the next, they're not able to do it. Yeah. So that loss is sudden, and that is a big one. Some of you said relationship. Why would we lose relationships if we have an illness? Why would relationship be something we lose?
Because you don't feel equal anymore.
You don't feel equal. Yeah. What else?
Because you no longer have the same kind of, I shouldn't use the word relationship here, but, like when my mother had dementia, I no longer shared that same relationship. I could not talk to her in the same way. So I think, there's a lack of, yes, Anita says, communication, but also it was how we related or what we talked about. Those things
Yeah.
were not there.
Absolutely. That's a very poignant reminder, Indira. Thank you. And I can see that people are putting in very sensitive and thoughtful responses in the chat box. So thank you very much. Not everybody wants to deal with your disease. Uh, in some cases, like head and neck cancers, where the face is disfigured because of tumors and things like that, very often people will withdraw because they don't want to be seen like that. Even if they have people who care about them wanting to visit, they don't want to be seen like that. So these people will try once, twice, three times. After a while, they give up.
Mm.
Okay, so disfiguring diseases will do that. Stigmatized illnesses will do that. And also, like some of you said, that sometimes you just don't have the energy to participate. And sometimes, unfortunately, you lose aspects of your personality that kept you in that relationship with somebody. So relationships are lost. And this is true for both the person living with the illness as well as the caregiver, right? Because also as your caregiving role increases, you are also as much isolated as the patient is. Okay. Material and economic losses. Okay. I might lose my home. I might lose my savings, my pension, so many things. We've talked about financial toxicity and all of those things. Time, time, where does the time go? Not just time in terms of how long I will live, time in the day. All my time is going in doctor's appointments, one medication to another, to, I need to eat this because I can have to take this medicine. I have to do this on an empty stomach. Everything is going, all your time is going in that. Planning your next appointment, sitting in traffic, waiting to get to the hospital. So time shrinkage happens for both, again, the caregiver as well as the patient. So you're losing time. And also, if it's a terminal illness, you are losing time with your family. You're losing time in the future. Opportunities. I lose the opportunity, a promotion. I was this close to a promotion before I got diagnosed with something. Or I was this close to a promotion before I became a caregiver and I had to quit my job. Opportunities to travel, opportunities to visit other families and friends, opportunities to study further, so many things, opportunities to maybe to move house, maybe you wanted to go back somewhere to closer to your family, whatever. So opportunities are lost. Plans. How many of us, how many of us had big plans in 2019 December or 2019 Feb? What happened to those plans once the pandemic hit? So your plans get derailed. Okay. So, and that I was talking about us as a community, but as an individual, when you are diagnosed with an illness or someone in your family is diagnosed with an illness, a lot of your plans get derailed. And the loss of plans is like loss of dreams, no? When you lose a dream that you worked really hard towards, or a childhood dream that you nurtured, you wanted to grow up and become a doctor, or you wanted to grow up and travel to this part of the world, and now those plans are gone. That is also a huge loss, and that loss also warrants grief. Okay. Autonomy, we talked about this. Once you become a patient, everybody has a right over what is good for you, what is not good for you. Everyone is making decisions for you, and you have lost your autonomy, lost control. This is a big one. Suddenly, we are no longer in control of our lives, and who is in the driver's seat? The disease is in the driver's seat. Okay. And for a lot of older people, this is a particularly difficult loss to live with, because they have been the decision makers in the family, they've been the disciplinarians in the family, they're the ones controlling the finances of the family. Suddenly all of that is out of control. And finally, dignity. We've talked about dignity before, the loss of dignity, not just in terms of physical dignity when you go to a hospital, but also your dignity in terms of, patients not being given the respect that they should be given, people who, the way sometimes they're treated in the hospital system, things like that. And they're stripped of their dignity and they become another case. Okay. And also a functioning member. The family as a unit loses a functioning member. Like I said, so this is very closely associated with the identity and customary roles. And suddenly I've lost a functioning member in my family. Okay. Now, grief is a total human experience. And what do I mean by this? Grief is a total human experience. It's not just an emotional experience. Grief is something that you experience in all of these domains. Now, I'm going to quickly again stop and check in with you. Now, when you feel grief, where do you feel it in your body? How do you describe your grief to somebody else? I was so sad that how do you describe the physical expression of your grief? Headache, okay. Heavy heart, chest ache, I have to warn you, Shri, that there is suddenly a storm coming where I am. So I may lose network. I'm very sorry in advance if that happens.
Fingers crossed, ma'am.
Okay. Chest ache from my heart, numb tears. Okay. Choking up. How many times is grief described as, oh, she was all choked up? Okay. Heavy chested. I feel a tightness in my chest. I feel a burning behind my eyes. All of these things. You ask children, there's a very sweet experiment that was done with kids to ask them where they feel grief, and their answers are really the sweetest answers. Lump in the throat, yeah, broken. So all of these words that you're using are physical words. These are physical words because somewhere down the line, this is how we experience it, right? And tightness in the shoulders, yeah, tension. So, and you also, grief comes out in not being able to sleep, or some of us, when we're sad, we go straight to the fridge. I'm one of those people. And if God help the ice cream that's lying in my fridge, if I'm sad, I'm eating it. So it manifests in, I can see some nods. Okay, so it manifests in disruptions in appetite. Grief and powerful experiences also show up in your stomach, in your gastrointestinal tract. Not being able to digest food, vomiting, diarrhea, whatever, lack of hunger, so many things. So grief is a physical experience. Grief is also a cognitive experience, which means it interrupts or interferes with your thought process. I am not able to pay attention. I'm not able to make decisions. I'm not able to think straight. I can't remember. My memory is messed up. So those are cognitive processes that get affected by grief. Grief is a spiritual experience. Meaning, purpose, loss, hope, connection. All of these are spiritual experiences. I start questioning God. If that's the way I see spirituality. I might lose interest in things that otherwise were my passions. Okay. It's an emotional experience. We know that. And emotions, grief is experienced not just in terms of sadness. How else do you experience grief? Grief is a very, very messy experience to have. So what are some of the other emotions associated with grief? Anger, yeah. Anger is a very, very powerful part of grief. Agitation, crying, okay. Irritability, yes. No patience for anything else. It can be aggression, yeah. Anxiety, yeah. So grief is it's an emotional experience. How is it a social experience? Why is grief a social experience? Isolation, withdrawal. Shri, I don't need to teach this class, I think. Everyone's pretty clued into what grief is all about. Okay, disconnection with people, yeah. So it's a total human experience, and it is experienced in different ways, which also means that different people experience it differently. Yeah, no two human beings will experience grief in the same way. It's a messy business. And so we need to be aware that if somebody is sleeping for 3 days, it could be grief. If somebody is also, social withdrawal is one thing. Some people just go out and party like mad. That is also a coping strategy. I did that when I was 19 years old because it helped me forget. Okay. So it could go any way. So sometimes we see people behaving in ways that are out of character. It could be a sign of grief that they are showing. Okay. And there are many factors that influence grief. I'm not going to get into this theory. Those of you who are interested, you may please look it up. Mary Ainsworth's study of attachment styles. So the way we attach to people through our lives also kind of affects the way we grieve over them. If I am enmeshed with somebody and I'm overly attached to them, my grieving style will be determined by that. And so attachment styles, there's avoidant, there's all kinds of things. So how we attach as youngsters to our primary family members will also determine how we grieve when we lose them. Okay, so that is Mary Ainsworth's study. I mean, that's one of her theories. Although attachment styles was also talked about by other psychologists. Family structure. How is the family structured? What are the subgroups? What are the boundaries? Are they flexible? We talked about this in the genogram, right? Who will lean on whom? And what are the subgroups? Is somebody now isolated because the other person is gone? Okay, maybe I had an alliance with my mother, and now that she's gone, I'm isolated within my own family. So these also affect how grief is experienced. Communication patterns within the family. Am I allowed to express my grief? Or am I supposed to, just be stoic? Who is there to receive it? Is there somebody who is a problem solver? Is there somebody who is more emotionally nurturing? Who am I likely to go to when I'm sad? What kind of comfort do I need at that point? So communication patterns, whether they're open, closed. Social support, whether my family is cohesively engaged with the larger community, or is my family isolated? Okay, the eco map. This is where the eco map comes in. Who am I leaning on? Am I particularly close with my congregation or my faith group? And that's where I find support. Whereas my brother, who's an atheist, he finds support by hanging out with his friends. So who is the family associated with? Who are they cohesively associated with? Okay, now many of you know the stages of grief. This is one of the most common ideas persistent in palliative care, in any death and dying studies. And we know that the person who came up with the stages of grief theory is Elizabeth Kubler-Ross. And these are the stages, yeah? Denial, anger, depression, bargaining, and acceptance. Now, the biggest myth about the stages of grief is that it happens sequentially. It does not. You can bounce between the stages. You can skip stages. You can, okay, just Shri, give me 1 second. All my windows were open for the summer and now the rain is coming in. So just give me a second.
Sure.
I know some of you. So yeah, the stages of grief, basically, they do not happen sequentially, and they certainly don't have to happen. Okay, so somebody who has completely accepted the loss can go back to being extremely angry the next day. There is no rule that once I have accepted it, I'm not going to feel the negative emotions. Okay, so I just wanted to put that into perspective, that it's not necessary that the stages will happen in any particular order. And very often people just skip through stages, or they'll keep revisiting stages depending on various things like new information coming to light, developmental stages that they're going through, events in their lives. I mean, marriages, childbirth, graduation, so different emotions keep coming up depending on where you are in your life, and new milestones. Yes, Aparna. Okay. Now, I'm just going to take you through a couple of contemporary frameworks of understanding grief. And this is something that is more recent compared to Elizabeth Kubler-Ross's theories. And again, I urge you to please do your research and to explore these further if you are interested, or if something about them strikes a chord with you. One of the helpful frameworks is the tasks framework by William Worden. And the concept of tasks originates in developmental psychology. Developmental psychology looks at how a person attains various milestones as they grow older, from babyhood to adulthood and towards the end of life. And just like a child is required to accomplish various emotional, social, mental tasks to adapt, so does a person experiencing loss, grief, and bereavement. Okay, so there are tasks that we are supposed to fulfill as we go through the experience of grief and bereavement. And mastery of one task impacts mastery of higher order tasks. So if I'm able to do this, that will also influence how I'm able to do the next thing. Okay. And not to say again that it's sequential, and once you get past a task, you don't have to revisit it. It just means that you get better at it, and from time to time, you will go back to a task if it is needed.
Is it only for me that
We'll pause after that to take any questions. Now, according to William Worden, the tasks that need to be tackled, there are 4 tasks. The first is to accept the reality of the loss. The fact that the loss has happened and the loved one is not coming back. Okay, or that this loss of mobility has happened, I'm not going to be able to walk again. I have to accept it. The second is I have to process the difficult emotions that come with it. I have to process it by experiencing it, and I have to be able to express it. Okay, and this is a very, very important task. The third task is I have to adjust to a world without that person or without whatever it is I've lost, and make changes to my daily life accordingly. Okay. And lastly, I have to emotionally or spiritually relocate that what I have lost, whether it's a person or whether it is it's a loss of another kind. Now, let's go through this again. I have to accept the reality of the loss. I have to process all the difficult emotions that come with it. I have to adapt and adjust to a world without that person or ability or whatever phenomenon that I have lost. And finally, I have to spiritually and emotionally relocate it. It might seem very straightforward, but it's not. Because how many of us know people who, so there are different kinds of acceptance. I can intellectually accept something, but I've not emotionally accepted it. Yeah, I know my son has died intellectually. You come to my house 2 years later, his bedroom is like a shrine to him. I haven't moved a single shirt or pair of trousers. I've left his study desk exactly the way it was the day he died. His toys are still in his room. So what does that tell you? Have I fully accepted the loss? No. Now, so intellectual acceptance is step 1. Emotional acceptance will take some time. So we have to also be patient about it, right? The other thing is to process. And I think a lot of people find it unusually difficult to process ugly emotions like anger, or emotions like bitterness or resentment, or even relief. I'm relieved that this person has died because now I'm feeling guilty. So I have to be able to express honestly all of these different emotions that I feel. The third is I have to adapt to that person not being there. Now, for different people, it means different things. Somebody could be my emotional support. Someone could have been my confidant. Someone could have been the one who cheers me on and is my biggest cheerleader in my life. But it could have also been an abusive relationship. It could have been a relationship with domestic violence. It could have been a relationship where he or she was my abuser. It could be a relationship where he or she never allowed me to make decisions on my own. I suddenly have to start doing those things. Okay. And finally, I have to emotionally relocate the person. Now, what does that mean? One of the ways we emotionally relocate somebody is, I'll just give you an example. It is, we start a scholarship in their name. We start a charity in their name. We might have a particular ritual that we do every year. Or we might, so things like that. So they're very much a part of our lives emotionally, but now I have a way to channel it in a different way. Now, a simple question is, does a relationship with somebody end when they die? No. My mother will always be my mother. Now I might speak to her in my mind. I might say, okay, what would you advise me to do right now? My relationship is still ongoing. Now what I've done is I've emotionally relocated her and spiritually relocated her. So I tap into that relationship from time to time, but it doesn't hinder me from moving forward. We will talk about complicated grief in some. So I'm not going to get into that right now. So are we clear about the 4 tasks? I clarify any questions? Does anybody have any thoughts on it? I'm just going to take a breath over here so that we can just address this, because these are slightly, they can subjects. Okay, we're good to move on? Yeah. Shri, are you able to hear me okay?
What
Yeah.
would the
Yes, yes.
process of grief involve here, Smriti? Are they internal processes, or is it also having, a commemoration meeting or something? I mean, are those processes?
Good question. They're both external and internal. So I'll just address that in a second. Yeah. But that's a good question. And I'm going to go to that next if everyone's okay with it. All right. Now, one thing we need to understand that it's are not my revisits. I'm just going to turn my video off for a few seconds. Okay. Yeah. All right. Now, this is actually a very, very important slide, and I'd like you to take note of it. The mediators of mourning is something that this lady called Therese Rando came up with 2 years after Worden came up with his framework for the tasks model. Now, before I attempt to support somebody, the mediators of mourning are this. We need to understand what is the person's relationship with the deceased. And I don't just mean in terms of mother, father, sister, brother. What is the quality of the relationship? Like I said, it could have been a conflicted relationship. It could be an overly dependent relationship. I depended on that person for all my needs. That person would have been my protector. That person could have been the one I protected, right? So what is the person's relationship? What are the circumstances of the death? Was it expected? Unexpected? Sudden? Was it peaceful? Was it violent? Was it with a lot of suffering? What were the circumstances of the death? What is my coping style? Some people have their coping style is to look towards their social circles. Some people lean on their faith. Some people, my style is to just roll up my sleeves and start working on issues that I can solve. I'm a problem solver. Or is my coping style to cry a lot for 2-3 days and then just get on with stuff? What is my coping style? Who is my support system at this point? Do I have a support system? What are my life experiences? Have I lost people before? Is this my first loss? How did I deal with previous losses? Is this the third death I'm experiencing in 2 years? Or is it the first death I'm experiencing in 50 years? Okay. All of those things. Have I had other losses? Have I been displaced? Have I been, what are my socioeconomic, conditions at the moment? And what is my worldview? Now this, I'm just going to stop for a second. What do I mean by worldview? My worldview means how I look at the world. There are people who say only bad things happen to me. There are people who say, okay, my God has punished me. My worldview is that bad things happen to bad people. So then my thought process is here is what have I done wrong? So my worldview is my script that I have and how I perceive the world. The world is a cruel place. Or I might be someone who says, you know what? It's God's will. This is how things happen. I have to accept it. This is part of God's plan. So my worldview will also tell you how I'm going to cope with it. So some of these mediators of mourning, so you might have two people, both are 19 years old, both have lost a parent to the same disease. But for one, it's the second parent that is lost. So she's now technically an orphan. For the other, it's the first parent, but comes from a very strong support system. So you see, that's where the stories start to change. So these are your mediators of mourning. And these are questions that you have to navigate before you're able to truly support somebody who is grieving. And a care provider cannot help people with tasks of mourning without a thorough understanding of these mediators. So that's very, very important that we always look at this. She also introduced 2 additional tasks. She said, okay, Warden had these 4 tasks: accept the reality of the loss, process your emotions associated with it, adjust to a new world, and relocate the person emotionally. But she also said you have to discover a new sense of identity for yourself. Who are you now? Okay. And very importantly, seeking meaning in life, finding a way to make sense of the loss. Now, these are 2 additional tasks that she brought in, which I think are exceptionally beautiful and relevant tasks that she talked about, right? Now, I'll just tell you the story of a lady that we helped with. Educated, affluent, 2 daughters, and they were doing very well for themselves. And the husband had ALS, and she was his primary caregiver, not because they could not afford help. It's because he insisted that she be his primary caregiver. Conversation with the family, and he lost various aspects of himself very quickly. So soon he couldn't speak. Then first he wasn't mobile, then he couldn't speak properly. You had to hold up a chart where he'd with his eyes point at alphabets. So you had to string sentences together for him. He couldn't swallow all of that. But through it all, this man made sure that she was the only one caring for him. So when we got into it with the family, we found that they had a very long history of dominance and abuse. He had been an abusive husband, emotionally, financially, and sometimes physically. And this was his personality. So even when he was frail, he insisted that she would continue to do things for him, which she did till the day he died. It took us 3 months to get her to step out of the house and start doing things for herself, because she had never been allowed to make a decision for herself. She didn't know who she was without him, and they'd been married for 45 years. Now, where do you begin, right? Here's a woman whose entire identity was locked around this guy. He made all the financial decisions, and she's a wonderful woman, and she had the education, she had everything. She was just it was this learned helplessness that she had picked up along the way. So for her, one of the major tasks after the loss of her husband was to rediscover herself. And that was one of the major tasks. Acceptance and processing and all of that happened fairly quickly because she'd been looking after him for so many years. These 2, finding meaning in the loss and rediscovering your identity, became her major tasks. Okay, so so in that sense, I find that Teresa's addition of these tasks was very relevant. Okay, now, so that's the framework by William Worden and Therese Rando. I'm just going to talk to you about one more framework, which is the dual process model. This was from 1999. And here it talks about grief very simply. It says grief is a 2-dimensional process. There is loss orientation and there's restoration orientation. And here in loss, we're dealing with the emotional aspects of the grief and, accepting the loss, etc., etc. Restoration orientation is focused on diversion from grief and ongoing practical changes. So while I grieve for my loss, I still have to make changes. So in a way, it's just rearranging Worden's tasks. What essentially they're saying is these tasks happen simultaneously like a seesaw. So while you are also dealing with your loss, at the same time, you are reconnecting with life. And oscillating between the two is considered normal. And we have to give permission for people to oscillate between the two and let them express themselves. And so in the immediate aftermath of a loss, we spend more time in loss orientation. We're trying to make sense of the loss, we're grieving, we're all of those things. But slowly, life starts to move on and we start re-engaging. A caregiver who has given up a job to stay at home now suddenly is looking for work. They might move out of the house that they were living in earlier. They might move cities. So many things people might do, or just simple things, clearing out the house, changing the finances, the financial, the way the house functions financially, so on and so forth. So loss orientation and grief and restoration orientation happen side by side. So here, Doka and Martin in 2010 said there are three aspects to grief. One is how we experience it, one is how we express it, and one is how we adapt to loss. And now all of them are interconnected. Okay, how we experience it, how we express it, and how we adapt to it. Now, historically, people talked about masculine and feminine, or, they associated certain attributes. So what are some of those attributes? Men don't cry. Women are more emotional. What are some of those other gender-based myths? Men are supposed to be strong.
Men
Women
are
are
better with finances and investments and taking care of the family.
at a time like this. Men are more overtly functional. Yeah. What else? Any other? Women are sensitive. Women don't understand technical things. Yeah, correct. Okay. Then over a period of time, some people got sensitive about it and said, no, this is not right. And they started talking about it in terms of masculine ways of grieving and feminine ways of grieving, which is still problematic because you're still ascribing gender to it. So the newer way of looking at it is intuitive and instrumental, which is gender free. Okay, so instrumental and intuitive. Now, what does this mean? It means that these are individual styles. People who lean on being more intuitive are more emotional and expressive. They spontaneously express their feelings. They seek support from family and friends and all of those things. Okay. Whereas instrumental people are more practical and action-oriented. They prefer to discuss problems rather than discuss their feelings. They focus on problem solving. And you could be a man or a woman, it doesn't matter. So we're not saying masculine, feminine. We're not saying male, female. We are saying intuitive and instrumental. What we're also saying is that you can be blended. And most people are. I will be intuitive at home and instrumental at work. I can't be going and crying all over my workplace if I'm problem solving at home, right? So we have to balance it out depending on the context that we're in. But in some cases, it's dissonant because especially then your gender comes in. If a man starts to cry, he's told not to. If a woman doesn't cry, people wonder what's wrong with her. And if the woman becomes the pragmatic problem solving one, so the dissonance comes from what society allows us to be. I might be an extremely emotional man, but my culture, my family, my society does not allow me to express it as such. So there's a dissonance. How I'm feeling and what I'm doing are two different things. As a woman, I may feel numb and emotionally flatlining when someone has died, but people are expecting me to cry and make a scene. So that dissonance is that I'm not feeling that kind of heavy emotion right now, but I'm being forced to express my grief. So intuitive and instrumental is how we currently perceive. We don't say masculine and feminine anymore. All right. And also, grief and loss do not exist in a vacuum. Whether or not we are with our families, are part of society in a more sort of uh, visible way or not, grief is experienced within an individual, within a family.
Network issue only for me, or
At one second, I'm just getting it up. Yeah, that we don't exist in a vacuum, and community, family, and individuals are interconnected. Okay, so my screen's visible. All right. One of you, I think Narmada, talked about anticipating a loss. So now we're going to talk a little bit about anticipatory grief. Yeah, and this is something that people might know the word, but anticipatory grief is basically grief that is felt in anticipation of an impending loss. I know that this person is terminally sick, and that knowledge itself is making me experience grief. And this occurs before the loss. It happens at the time of diagnosis of a terminal illness, negative test results coming back, and also even before a major life change, like the end of a relationship. People who are going through a divorce, I mean, even though it's a difficult life change, there is some loss, a sense of anticipatory grief and loss associated with it. It is a very complex and very intense experience. It is not straightforward. And from my own personal experience, I can tell you that when I was much younger and when my adoptive mom was sick and I got thrown out of her room several times in the night, it was anticipatory grief, because my father is the one who sat down and said, how many people does she have to say goodbye to? And maybe she's preparing you for her loss. And that was a kind of manifestation of anticipatory grief, because it comes out messily sometimes. And anticipatory grief can also it can look a lot like depression. So we need to be careful here. We cannot be diagnosing people as having depression if anticipatory grief is something that they could very well be facing at that time. And I will talk to you a little bit more about the distinction between grief and depression. Okay. And if it is managed well, it can help individuals prepare and deal better. So advanced care planning, talking about what is important to you at the end of life, talking about, okay, spending time with the children, doing little things that were on your bucket list, things like that. If it is mismanaged, it can impair coping and lead to worse outcomes. You have to be able to recognize that somebody is experiencing anticipatory grief, because what happens is, sometimes what happens is toxic positivity comes in. Come on, be brave, be strong, think positive. You don't allow the person to experience that anticipatory grief, which is so important. And can anyone tell me, when someone has told you to just think positive when you're feeling bad, has it helped? Huh? When you're depressed and someone tells you, come on, chin up, think positive. No, na? So it's like telling someone with asthma that, come on, breathe better. You can't do it. I mean, I know it's probably an insensitive thing to, but if Shalaka is laughing, that's fine. But it's as bad as saying that. You cannot tell someone to just, come on, get over it. So a lot of the times, this is the problem with toxic positivity and optimism. And unfortunately, as a society, we do it a lot. asking someone to be brave, asking someone to smile, to look, only think positive, it's going to get better, it's not going to get better. And then what happens is when things don't go as planned, when you're not able to fulfill your wishes, when you're not able to finish unfinished business, it's that much worse. Okay. All right. Smack that person. Yeah. See, so toxic positivity is not good at all. The third thing I want to talk to you about is disenfranchised grief. It's a bit of a mouthful, this word, disenfranchised grief. And to me, it's a particularly poignant kind of grief. What is disenfranchised grief? Disenfranchised grief is grief that is not openly acknowledged or not socially supported or considered unacceptable by others. I'll say that again. Grief that is not openly acknowledged, not socially supported, or considered unacceptable by others, not socially validated. Correct. Yes, Aparna. So let me stop for a second here and ask you, what kind of grief is this? What kind of situation would lead to grief not being socially supported or not being acknowledged by others or not being acceptable to other people? Any examples of disenfranchised grief that you can think of?
In an LGBTQI,
Yes. In same-sex relationships, in relationships that are not condoned in society? What are some of the other kinds of relationships not condoned? Pets. Yeah. Yes, a woman loses the man she was having an affair with. Yeah. Pets. Who else?
where a marriage doesn't have the blessings of the family and they've just probably stepped out and got married without the wishes of both sides.
Yeah, absolutely.
Smriti, what about all the professionals working in palliative care? And sometimes they may going through grief with the loss of some of the patients, and people may not even acknowledge it as grief. They may think, yeah, it's your professional job, so you're going about it.
Absolutely. Thank you for saying that. And not just palliative care professionals, any medical professional. What happened in COVID was also we found this tremendous distress in the healthcare system because they were not able to deal with the volumes that they were seeing. Yeah. And yeah, we're not allowed. That professional relationship that says, okay, you see this is part of your profession, so you should be able to cope with it better. Yeah, that's a very important one. And it's a very, all healthcare providers, especially palliative care providers, are at risk for disenfranchised grief. So thank you very much. Relatives you are not particularly close with. Why are you so sad? Yeah, you weren't that close. It could be that. Losing someone who has committed a crime or is a known abuser. Thank you very much. That is absolutely right. Recently there was that stabbing in that Australian mall, if you read about it. And one of the most difficult things I watched was the parents coming out and acknowledging their pain. It was one of the most difficult videos to watch because they said that they acknowledged the horrific crime that their son had committed, but their loss and their grief was so complex because, a lot of people were blaming them for the upbringing of that man. So disenfranchised grief. In some societies, suicide is considered a sin. And someone who has died by suicide, the family is not allowed to grieve. What happens when someone overdoses on drugs? Someone is an addict, someone's a substance user. Oh, he's been using drugs all his life, It must be a relief that he or she is dead. Yeah. And so those are all examples of disenfranchised grief and also a divorce. Two people have decided to split up. Are you should be happy, yeah? Why are you grieving over that? But loss of for a caregiver, I lose the opportunity to go abroad and pursue a career I wanted. I'm not allowed to grieve it because the person I'm taking care of has cancer. So what is my loss compared to what that person is going through? How dare I be selfish and grieve this loss? At least I'm alive, right? Survivors sometimes have that sort of, all of these things are disenfranchised grief situations. And I implore you to please look out for who might be disenfranchised in that moment, who is not being able to grieve because they're not being allowed to grieve. Yeah. So disenfranchised grief, all of you have covered the slide already. The relationship is not recognized by others because they didn't know you had a relationship. The relationship was real, but the family or society does not approve. It's non-traditional. The way a person died is not as supported as other deaths, such as a drug overdose or a suicide. And also experience when the loss is not a person. It could be a beloved animal, a failed marriage, unfulfilled dreams, financial loss, business loss, and the loss of a loved one's functioning in cases like Alzheimer's and dementia and so on. I mean, that's also something. High-risk individuals are people who have a history of addiction, mental illness, criminal record, healthcare providers. These are just some of the people who are at high risk. And therapists are expected not to grieve. And Firdaus, you know how that has worked out for our community, right? The highest suicide rate amongst professionals is amongst mental health providers. That's a fact across the world. Okay. Now, complicated grief. Okay, I'm just going to stop here for a second. Everybody, please take a deep breath. These are all heavy topics. And so we've talked about grief. We've talked about a couple of we've talked about stages of grief. We've talked about contemporary frameworks. We've talked about Warden, Rando, and we've also talked about the dual process model. And now we've talked about anticipatory grief and disenfranchised grief. Okay, so now last few things I'm just going to do with you quickly before we stop for the day, because we have one more session on bereavement after this, which is also quite heavy. We're going to go into complicated grief. Now, complicated grief is grief that is characterized. Okay, someone please take the mic. Any takers? Just tired of the sound of my own voice.
Yeah.
Go for it. Yes, please. Thank you.
Complicated grief is characterized by intense and persistent yearning or longing for the deceased, difficulty accepting the death, persistent feelings of disbelief or shock, emotional numbness or detachment, difficulty experiencing positive emotions, difficulty engaging in activities that were previously enjoyed, guilt or self-blame related to the death, intense feelings of anger or bitterness, difficulty trusting others or forming new relationships, preoccupation with thoughts of the deceased. Lastly, difficulty with daily functioning such as work, school, or self-care.
Thank you very much. Let's bear in mind that each one of these points is something that may be felt by everybody in the immediate aftermath of a loss, in the acute phase of grieving. When this becomes problematic is when it stays persistent and we're not able to shake this off. Okay, now it can be very complex for us to identify that someone is experiencing complicated grief as opposed to depression. Some of the things that we need to look backwards at is what was the nature of the relationship with the deceased person? Again, the nature of the relationship is so important as a mediator of mourning, as well as in ascertaining whether this is a case of complicated grief. When I am overly, again, I'm going to repeat myself, when I'm overly dependent on somebody else to fulfill my emotional needs, when I'm overly dependent on somebody else for surviving, that person was my protector. We see this in a lot of cases where the woman is now, she's left a young woman is left behind with a child, and then suddenly she becomes prey. There are predators around her in terms of just in terms of attention unwanted attention that she's getting and so on. Or it could be, like I said, complicated relationship where they did not get along, but I had to be the caregiver because that was my role. And what that has left me with is bitterness that I've spent the last 5 years of my life looking after this person, and this person was mean to me right throughout, even as I looked after them. Circumstances of the death, a classic case, and we are in probably an epidemic of complicated grief after COVID. Why? Because people just disappeared from our lives. Circumstances of the death. Got some symptoms, got whisked away to the hospital. We were not allowed to see them. We were not allowed to be next to them. We were not allowed to interact with them. And then suddenly they're gone. We're not allowed to even do their funerals. So the number of people experiencing complicated grief after the COVID-19 pandemic is tremendous. It's a matter of actually identifying how many people are experiencing it. So circumstances of the death, violent deaths, suicidal deaths, murders, car crashes, whatever, overdoses, all of those things. Okay, events that occurred after the death. Suddenly, I am left with a huge property dispute. Suddenly, there's issues in the family about who's going to get what material assets, and people are being, fragmented. Families are being fragmented. I might lose I didn't know that this person has so many debts, and I've inherited all these debts. So suddenly after their death, I have to sell my home. I realized suddenly that all these people are coming and telling me that this person had taken so many loans. I have to pay them off. I had no idea. I was not in control of the finances. And now suddenly I have to take care of all of that. It might complicate my emotions at that point, right? My persistent anger, all of those things, unable to think straight, all of those things that are associated with complicated grief. Lack of social support. I don't have any support after this person has died. Or in the case of disenfranchised grief, I'm not even allowed to express myself, and that becomes over a period of time complicated. The thing with complicated grief is that it dominates and overshadows life. And now, in 2020, it was included as a prolonged grief disorder. Okay. Now, prolonged grief disorder, right now, we are involved in a prolonged grief study in Pallium. We're trying to, we're part of the study with Queen's University, and we're looking at various facets of it because WHO is now looking at it very closely. What are some of the issues that arise from prolonged or complicated grief disorder, because it is a serious mental health condition. It can be a serious mental health condition. So evidence around this is still building. And at this point, it's also very important for us to make the distinction between grief and depression. It is not easy. I mean, I'm telling you this up front, it's not easy. And they share several common characteristics. And these common characteristics that they have may include intense sadness, fatigue, sleep and appetite disturbances, low energy, loss of pleasure, difficulty concentrating, and overwhelming emotions that interfere with the ability to cope with everyday stressors. There's a sweet little, it's a sweet little drawing of this, of a person who is carrying a big load on their shoulders, and then they trip over one tiny little thing and everything falls down, and then they've fallen apart. And someone comes and says, "Why are you crying? That was such a small little obstacle." That one obstacle basically just broke the camel's back. It's like that because you've been carrying this burden for so long. After a while, even the smallest of things start triggering you. So overwhelming emotions that interfere with the ability to cope with even everyday stressors. Now, these are what they have in common. But here is where you need to make the distinction. Grief is specifically triggered by the loss of a person or a major loss, okay? Like your ability to walk. Usually stays, while the person is grieving, they can usually stay connected to others, periodically experience pleasure, and continue functioning as he or she rebuilds his or her life. So I'm grieving my mother, but I'm still bonded to my brother. I talk to him about stories that we share. I might talk to my friends. I'm still maintaining a human connection with all of these people. Okay. Treatment through grief-focused therapy. Depression is a mental health disorder. It's not always affiliated with the loss of a person. It can be triggered by a variety of factors. And there is a marked loss of connection with others and an inability to experience even brief periods of pleasure. If I'm depressed, I'm going to withdraw from everyone. So that is one of the hallmark differences between the two. Okay, I'm unable, and I remember, like, in the immediate aftermath of a death of a loved one, the first time you laugh at a joke, you almost feel guilty about it, right? But that doesn't stop you. You realize that that's a sign of life and it's a sign of health, and it carries on. And you still have young children to look after. There's still beauty in the world. You know, you're still moved by things like that. Whereas in depression, that doesn't cut through. And uh, depression may need treatment with a combination of therapy and medication, as depression does. And unresolved grief, how it might manifest is serious disease of psychosomatic origins. There doesn't seem to be a physical reason for me to express or to manifest some disease symptoms, but here they are. I can appear to be stuck. I'm angry all the time, or I'm negative all the time, or I'm just, constantly like feeling like a victim, or all of those things. So I'm just there. I'm just stuck in one particular zone, and I'm not being able to move on from it. So that might be a manifestation of unresolved grief. Especially in people who are, high risk groups here are also adolescents and children. And we will be talking about how children cope with grief. But in a lot of children, they may not be crying, but they might be acting up in school. They're getting into fights. They're bunking class. Their grades are slipping. Those kind of things. In older teenagers and stuff, suddenly they're experimenting with drugs, with alcohol, with smoking. Those kind of self-sabotaging behaviors are coming in. They're running with a crowd that is known to be in quotes, bad crowd, a bad company. They're keeping bad company. So this could be signs of unresolved grief, especially in young people. So please, please, please don't pass it off as these are people that are being, dekho, this family has just suffered such a major loss and all this child is doing is behaving badly. That bad behavior may be a sign of grief. So that needs a little bit more looking into. Suicidal ideation or attempt, especially if someone has been the anchor in my world and now I'm unable to cope with all my social stressors and my emotional stress and stuff. Suicidal ideation or attempts might manifest if the grief is unresolved. A marked alteration in style of living. Suddenly I find that this person who used to be such a health conscious and tidiness and neatness person is now, the house is a mess. They're disorganized. They're not even like, having a bath. Maybe they don't care about their appearance anymore. Someone used to enjoy cooking, now can't be bothered. They're ordering in all the time. Someone who liked to go for walks is just staying cooped up with the curtains closed. So these are all marked alterations in styles of living and disruption of important relationships. So part of the self-sabotage is this. I've lost someone so close to me. I don't want to ever feel like this again. So I'm going to sabotage my relationships and I will disrupt it. So even people who care about me, I might push them away. This is a slightly more complex area, so I don't want to get into it because we're getting into some deep psychological territory, but these are just things for us to look out for. So anyway, I'm sharing these slides with you, so you don't have to take these on, but these are many ways in which you can assess grief in a more formalized sort of setting. Some of these questions are also just good to go through to understand how grief is assessed. Yeah. And grief management involves education, counseling, support groups, pharmacotherapy. Education about what? About grief itself. That this is normal. Grief involves anger. Grief involves rage. Grief involves feeling relieved. There are elements of guilt. It's okay. Education about, the fact that what are the statistics in terms of how people's trajectories are in this kind of an illness. Counseling, of course, will have different aspects to it depending on the person's coping. If they're coping badly, if they need better coping management skills, if the family dynamics are not healthy, things like that. Support groups. Sometimes you need people out. Sometimes you need people outside of your family to be able to experience some amount of relief and comfort. Because what happens is when a family has gone through a journey like this together, by the end of it, everybody is exhausted. Everybody is tired. Everyone is grieving. So you can't really lean on one another because people are experiencing grief in their own ways. So support groups very often help. Pharmacotherapy, in terms of, I'm not talking about serious psychiatric medication unless it is indicated, but pharmacotherapy also in terms of just regulating sleep for short periods of time, things that can help you with enhancing appetite, things like that. Okay. Okay. Again, I'm not going to go into this very deeply. Some psychological intervention frameworks that are typically used are cognitive behavior therapy, where the focus is on identifying and changing negative thought patterns that might contribute to feelings of grief and loss, especially when you can't get out of it. Okay, so the training there basically is to help people identify that this is how your thought process goes. Once this thought starts, this is the direction it goes in. But so if we break that loop, then how do we stop that thought in its tracks? It's not serving you. Mindfulness-based interventions, which promote acceptance and present moment awareness, reduce stress, and help with emotional regulation. Narrative therapy is about the story, the script, and how, especially if someone believes that their worldview is that, oh, our family is cursed. That's a story that you've told yourself. Our family is cursed, and this is how the family curse manifests itself. I mean, I know it sounds ridiculous, but you'll be shocked to know how many people actually think along those is focusing on exploring and reshaping the stories we tell ourselves. All the women in my family die young. That's a story sometimes we tell ourselves. So what is the story? And how can we change that story? And there are different techniques to it. Okay. And there are also things like acceptance and commitment therapy, which encourage individuals to accept their feelings of grief while also taking action towards their values and goals. And especially if there's been trauma that has been experienced, there is trauma-focused therapies that also people employ. So the choice of framework will depend on the individual's needs and preferences, as well as my expertise and training as a professional. One thing is that if I don't have the skill set for it, I have to refer. I shouldn't try and just do this on my own, because these are very tricky areas of the subconscious, and we can go terribly wrong if we don't know what we are doing. So it takes years to train in grief counseling, or it takes a lot of time to understand what is that territory that we're walking in. So you have to be very, very careful, and please don't hesitate to defer to an expert. Okay. 1 second. I don't know why I stopped sharing my screen. And so these are just some of the psychological interventions. But grief counseling, which is not necessarily going deep into psychology, what are our goals? Again, I'm borrowing from Worden's framework. It's to help the person accept that the loss has happened. I might slowly work with them to start giving away the clothes that they've kept, to start donating them, maybe different ways in which we can start saying, okay, this person is not coming back. To help the bereaved deal with both the experienced and the latent affect. So experience is what I'm experiencing on the surface and what I'm experiencing and expressing to everybody. But latent is also things that I might not be talking about, that it was a difficult relationship. I have a lot of resentment that I gave so many years of my life to this person. And now I've lost out on the chance to ever re-engage with the workforce. It could be many things. It's so not just what is being expressed on the surface, but also what may not be being expressed. to help bereaved overcome impediments to readjustment. What is stopping me from readjusting? Maybe it's the house I'm living in. Maybe it's the fact that I'm not able to move on from certain ideas that I have in my head. No, I've never ever taken care of finances. I don't think I know how to operate a bank account. He was the one who always did it. That's an impediment to my readjustment. So even practical skills like that, come on, let me come with you to the bank. Okay, let me see how we can do this together. That, like that lady who I talked about, who had been a caregiver for 50 years, we eventually got her to go for tennis classes. And that was one way of her getting out, getting some exercise, and also meeting other people, just taking on a sport. To encourage the bereaved to make a healthy emotional withdrawal from the deceased and reinvest energy into other relationships. This takes a little bit of time, but that is also one of the goals of counseling. Yeah. And we're not going to rush this. For some people, it takes years. So we really have to go by what they're ready for and what they're not. And most people resolve to a level of functioning after about 1 year. And some people need a little bit more time to achieve these tasks of grieving. And like I said, they might revisit, they might go back. And one of the things that we can do, I think, as a community is to advocate for sufficient time off from work for the bereaved, especially in the first few weeks of bereavement. I won't even just say first few weeks. I would say that even further down the line. And that's something that I will tell you we are considering, where we give someone time off soon after the bereavement is experienced, but also maybe give them an option of taking some time off later in the year, because for different people, the emotions hit at a different time. Not everyone is going to feel all the emotions in the first month. And we're going to be talking about that next week when we talk about bereavement. And we have to discuss the fact that grief spikes continue. Time is not the healer we think it is. Anniversaries, special events, special milestones will always have a surge of grief, even 10, 20 years later. So, or even for the rest of our lives. So I'm just going to stop with this for the moment, because it's been a heavy topic, and next session we will specifically talk about bereavement and how we can support people who are bereaved in very practical and tangible ways. But we have about 8 minutes, so I'm just going to throw the floor open for discussion or reflection if anybody wants to share anything that they have on their minds. Yeah, Narmada, please.
I think I wanted to say 3 things. I'm going to quickly get through them. The first was the most pertinent here, which was gender. We spoke about it earlier in the session when you brought up circumstances after death. I realized that it's really prominent that women and girls, as soon as someone dies, especially if it's a parent who dies, are often treated as a third person in that conversation and are told to get married off, treated like a family burden. And it's a huge stressor on the family dynamic and on like the complicated grief symptoms that they face. The second that I wanted to say was that example that you gave about someone who is essentially health conscious and doing really well and then starts to not function well. It goes the other way too. There are people who just function extremely well and people assume that you're doing well, there's nothing for me to worry about. And then it just like no one catches on to the fact that like they don't get depression inventories, they don't get anxiety inventories, nothing. No one's asking them how they're doing beyond the surface level. And therefore, when suicide or anything else happens, it's like, oh, I had no idea.
Yeah, so those are absolutely, spot on insights, Narmada. The pendulum can swing either way. And I would say, especially look to the person who has been the person doing the heavy lifting, or who is considered the rock in the family. Those are people we assume are fine. Like Narmada said, oh, they're great at it. They're the ones who handle all the problems. They're the ones who know how to cope. They're seeing a therapist. They've always been sorted. Those could be falling apart and we don't even know about it. So thank you so much. That is such an important insight. And what you said about gender and, especially in some, I've seen this in communities where, iski to jaldi se shaadi kar do, because then she becomes another family's problem. and then the security will come from the other family or whatever it is. And that does not allow you to really process your loss, because you're being basically, another major life change is happening. We're also going to spend a lot of time talking about that when we're talking about children, because how we manage children in situations like these really needs a very hard reset and rethink in society. So thank you very much. Any other thoughts from anybody? I can see a couple of things in the chat box.
I think there's another way how people express grief, especially men in our society, is um, there is no expression, like they're very normal. We would feel there is no overt expression, there's no inward expression, they're just very casual about it. So this is a very dangerous situation. I feel it's very critical to even seek, I mean, those people should seek, they'll not come front and ask, I need help or I need someone to talk to. But I think it's inevitable that somebody should go and speak, but that doesn't happen in societies like that. And there was one case in one of our family, and that person was like the rock figure, as you said, and everyone would reach out to him for everything. And he lost his youngest brother at the age of 38 during COVID. He did not show any, there was no slightest of emotions expressed by him. There was not a tear shed, there was no anger, there was no irritability. He was very casual. And people were very worried about what is he? Is he like affected by it or what's happening? So he was fine, but turns out after a few months, he had a heart attack, probably because he was penting up, he was not ventilating his emotions, which is very important. And turns out that in families like that, they don't even express it to their immediate life partner, even to their wives. That's a very difficult situation when you're not taught as a child how to express. And again, boils down to the fact that how your family's dynamics are, like how you are allowing a child to express. Again, it starts from the beginning. So if that person was taught to express his anger, emotions in a more overt way or inward way, maybe that wouldn't have happened. I think that's how it works out when we deal with family counseling or when we deal with children counseling. I think this is a very important aspect in our society.
Thank you so much. And I will also say that we were not taught it, and it was not even modeled for us. So now, I mean, one of the things that I do appreciate coming out of, like, especially some of the Western literature and stuff, is things around vulnerability, and how can you express vulnerability in a way that is safe, in a way that is held. And very often when we exhibit vulnerability is how we also give other people permission to do the same. And I think all of you here are here because you are in some form looking to help other people navigate these journeys. So I would also encourage you to demonstrate vulnerability by expressing your humanity. And I don't mean like I said, it's not that doesn't mean that we go and cry buckets more than the family does, but just to say that, I mean, to shed a tear, it's absolutely fine. To say that, yes, this was a really hard one. Even with my experience, this was a particularly difficult case, and I'm really affected by it. So I can't even imagine what it's like for you. Just to say that. And there have been times when I remember that I have been comforted by the family because I have gone and cried with them. And they remember it. They remember it. And they remember it with kindness a lot of the times. There is a lady called Rachel Naomi Remen who also talks about holding space with kindness. She's a physician. I'll send you the links with the learning material. Rachel Naomi Remen, and she's done some phenomenal work in this regard. How to hold space, how to generously listen, how to empathize in a way that encourages other people to also open up. I'm also wondering, this is something that I just want to leave as a reflection for the group, is in situations where the people who need the help most, like the men in our families, who absolutely don't believe in therapy, who absolutely don't believe in seeking help, how do we then, in an maybe not so direct way, work with them? How does
we start again.
Kailash!